With fall sports in full swing, parents may have increased concerns, especially about concussions. Concussions are the most common type of traumatic brain injury, and it's important for parents to be able to recognize the symptoms and seek medical care if they suspect their child has one.
So we asked our mid-morning pediatrician, Dr. Gigi Chawla from Children's Minnesota, to share some advice. Good morning.
Good morning. Thanks for having me.
Of course. Could you start by talking about what exactly a concussion is? I think we all know it's some kind of head injury, but what actually happens to your brain?
Yeah, so that's exactly right. Concussion is a head injury that causes enough of a jolt to the brain tissue where it's actually hitting the inside of the skull and causing damage.
So how do we minimize the risk in terms of on our children, and what advice do you have even for parents?
Yeah, so first of all, it's a huge problem, right? There are about 3 million people each year who come down with a concussion, about 300,000 high school athletes each year who come down with a concussion. So it is a problem. First, just recognizing that it is one is really the first step.
What are the signs?
So the signs of having a concussion can be very mild. I mean, you might not even notice it at the time, but it usually is headache. You can see some personality changes. Occasionally, kids will have even some memory loss, and then they'll be, they can be excessively sleepy. And so I think there are a lot of things to look for, but it can look very different. And so just being educated about that is really the first step in prevention.
And John, you played sports growing up, and we had this conversation. You think you at least had one concussion.
Yeah, and you don't know for sure, because back then, I mean, this is 20 plus years ago, I don't want to date myself too much, but that's, times are different. I don't feel like we looked at it as closely back then. But I have a 6 and a 3-year-old, and they're playing like soccer and things now. Do you have to worry about it at that young of an age, do you think?
Absolutely. I think unfortunately, we just don't know all of the symptoms that kids express at that age. They can just be irritable. So it is, but yes, absolutely, even at young ages, it can come just from horsing around or just jostling one another. So it is something definitely to be aware of, even at a young age.
You would think about that. That small.
With that young.
Not as much contact, for sports and things like that.
A knee to the head. I mean, and even for high school athletes, really, a significant fraction of these concussions occur during practice, not during games.
My brother had to quit playing hockey. He was a professional hockey player for a little bit, and it was mainly because of concussion. So as parents, when we recognize that our child may have a concussion, what warning signs do we need to look for, maybe not only 6 months down the road, but several years down the road?
Right, so I think that really highlights the concern about second impact. And even third impact, and really understanding that.
So that does make a difference.
It certainly does. If you have had one concussion, your risk for having a second concussion is probably 3 to 6 times higher.
Really?
More susceptible.
Right, you're just more susceptible. Really, whatever factors led to that, if you continue to keep yourself in that situation, you're at more risk.
And you think about Twins players, like Justin Morneau went through something like this, Corey Koski, where they had one, and then it just kind of continued a lot, it felt like, and which is a sad thing to see happen, but I know that definitely just even in baseball.
Do parents need to actually take action, or is it something that will kind of just take care of itself over time, have the kid rest or something?
Right, so the standard recovery period, although it can vary from child to child, is a minimum of 2 weeks to usually about 4 weeks. And that is the time that really they should not be participating in anything that would be of impact at all, and really just getting their brain rest, really no electronics, really,
That's
even
a tough one, no electronics.
Exactly. Even taking school pretty slowly, getting enough sleep, and just, taking that time to recover. Kids, however, can take a long time to recover. So it can be 6 months, especially for somebody who's had a significant impact. And so recognizing that if you get back into your sport, at the 2-week mark for most kids, or even at the 6-month mark for other kids who are really having a hard time not back to baseline, your risk of having another brain injury that would result in an even longer recovery is greater.
Well, I think the important thing is, too, now we're actually talking about it. We're more aware of it.
Exactly.
Okay. Thanks, Dr. Gigi.
Yep,
Thank you.